In today's class, we are going to see the next important topic in Unit 5, that is cryogenic technique. So the learning objective of today's class is that first we will be discussing what is meant by cryogenic techniques, and we will have a comparison between cryosurgery and cryopreservation. That is a two different concept. And also we will see the other applications where the cryogenic techniques plays a very important role, like organ and reproductive preservation, and how it's offering minimally invasive treatments. And finally we also are discussing recent innovations and followed by industrial applications. So first, before getting into this main topic of what is meant by cryogenic techniques, first we understood or we should get to know the patient perspective. That is empathize the patient side to get to know what really matters, why this cryogenic technique is needed. So that's how we started doing empathize. From that, we came to know the patient with a serious illness or clinical conditions like cancer, infertility, or organ failure. They literally feel emotional distress and physical. Physically they become so burdened. Okay, they are not able to do, or they are not able to carry out their daily routine as like other peoples do. And whatever the treatments they are going through for the cancer or infertility, there is no uncertainty. That means they don't know what is the real outcome, whether it can supports the patient's treatment or not. So that is the main thing. If you see as a from the person concerned, they literally lose their fear. They need some solution to support their treatment and also to manage their treatment in order to improvise their quality of life. And also in other aspects, if you see the clinician, the physician who is taking care of a patient illness, they have the three things there in mind. Whatever technology or innovation we are bringing into the society, they look for these three things. First one is safety aspect, and second one is the effective treatment, and also the solution whatever we are bringing, it should be in long term goal. So this is the thing they should prioritize whatever the techniques they can implement in case of treatment or whatever procedure. So for if you see these two concern, from patient concern and physical physician concern, there is a solution. That is what cryogenic techniques here comes into picture, because it literally gives a hope for both physician and the patients, because it whatever the expectation is being expected from the patient and clinician is being offered by this particular technique, that is what cryogenic technique. So it's offering minimally invasive therapeutic option, and it's giving long preservation methods that is being needed for so many clinical needs by supporting their organ transplantation or reproductive treatment process and so on. So now, where now see where these cryogenic application, cryogenic technique application is mainly focused. First one is oncology care. Okay, so oncology care in the sense the same cryogenic techniques we can apply in case of destroy the cancer cells. And second one is reproductive medicine, where you can use to preserve the sperm or egg cells for to carry out their reproductive procedure or treatment process. And second one, you can have this particular technique while doing transplantation, because you need a storage of organs in case of organ failures, and that organs has to be transplant, right? So in that case also the same cryogenic techniques you can use. And finally you have research innovation. So there are so many researches happening to bring so many effective treatments for identification so many drugs or new technology for improving the quality of a patient's life. So in that case also, if there is need of preserving any biological substance or biological organs, then we can go with the same cryogenic techniques. So these are the few applications. Next we will see the what is the working principle, that is the science which is behind of this cryogenic techniques. The simple concept of this cryogenic technique is that we are going to use the optimum temperature, especially that is below I mean 150 degrees Celsius. This is the optimum threshold temperature. We are going to freeze the organs whatever we want to store. That is a simple concept of this cryogenic. The cryo, in the sense, we are going to use minimum low temperature. So for to keep it in low temperature, we have some substance called nitrogen, liquid nitrogen, which is maintain or preserve whatever the substance we want to be stored or preserve at a temperature like minus 196 degrees Celsius. So at this degree Celsius, if you see, the cells almost stops their activity, but at the same time it will not decay. That is the important functionality of using this cryogenic techniques. The cryogenic at optimum temperature of minus 150 degrees Celsius or minus 190 degrees Celsius, by using liquid nitrogen, at this temperature the cells literally stops. That is 99 percentage of activation is being reduced, or it gets slowed down, but it will not decay or destroy. Okay, so we are preserving the cell from we preserving the cell with the whole functionality, and which and at same time we preventing the cell from decaying. So this how we are going to preserve the cells which can be used for further process or the treatment. We will see the cellular mechanism of cryogenic techniques. The first one is rapid freezing phase. So this is the phase where you can freeze the substance or the organs at optimum temperature. Second one is the membrane disruptions. Here you will not disturb the integrity of the membrane. So that is very important in case of cryogenic techniques. And third one is control thawing. So because it is the involvement of temperature, I mean controlled temperature, optimum temperature, it is very important factor to be concerned when you are preserving the organs or treating or destroying the cells. So the control thawing, it's nothing but controlling the temperature based on the applications. And fourth one is what tissue response. So tissue response, it depends upon what type of cryogenic techniques we are using, because we have a two types. One is a cryo surgery, and second one is a cryopreservation. So based on that, the tissue response will get vary. So finally, the cryogenic is a technique which offers a precisions in terms of medicine. So it's delivering a targeted therapeutic approach by means of giving minimal scarring and having very good recovery times, faster recovery times, and reduce the risk of other surgical complications. So it is best for outpatient procedure capability. So you can have your operation even like not critical things that we undergo for invasive procedure, and the repeatability of this particular procedure is very minimal compared to the other approach. So in this way, the cryogenic techniques is standing in a top one of the technique where you can go for minimal invasive procedure. So what are the other cryopreservation? As I told you before, you have a different core concept of being using this particular cryogenic techniques. One is cryosurgery, another one is a cryopreservation. So cryopreservation is something you have to preserve for a long duration, or later it can be used in future. So in such case, you have your application like reproductive cells and regenerative medicine. So reproductive cells, where you can preserve the sperms, eggs, and embryos, that you can use it in future for IVS procedures, and even you can store the blood products without affecting the cellular functionality of the blood cells and plasma integrity. Even we can use it for regenerative medicines, where you are storing the stem cells and bone marrow to treat the particular disorders like leukemia treatment, and or you can do some regeneration process like tissue regeneration. And even these cryopreservation plays a very important role in terms of researching so many things like preserving biological samples for in order to accelerate the scientific discovery even more. So next we will see how does these cryogenic techniques, it's expanding the life's potential of people. So what the current challenge is that the traditional we have so many traditional storage systems, but these limits the organ viability only for a few hours. That impacts really the patient's life. I mean quality of life and quality of time. In some case, it will end up with organ wastage, and literally the patient get lost their hope and also their life. So that high impact arise the demand to create some solution to offer or to address all this problems or all this current challenge. So here comes the picture of as a solution the cryogenic techniques, which preserves the all I mean which address all the problems whatever we stated before, and it will extend the storage even from hours to days, or in some case to the weeks. So that is the main benefits of using this particular cryogenic techniques. So future also, if you see this particular cryogenic techniques, it's giving the hope for the people to have I mean to support their quality of life in terms of organ transplantation or storing the organ, or preserving the blood, or preserving the stem cells, to be confident to carry out their life, to it's kind of giving confidence to face any sort of challenges even it comes in future. So that is how we have given some solution, that is with the help of cryogenic techniques. So then we have a simple activity follow this topic, that is think pair share challenge. So through this challenge, the here we conducted in the class, here the people students they form a team of two. They will ask you to take any sort of field in biomedical, and to have to they have to discuss what is the benefits and limitation of that particular cryogenic application in that field. So and then we have assessment. Here also you can see late few assessment that is related to topic. Later you can witness in this video. And finally, this is the summary and overview of this topic. So the first we have discussed what is mean by cryogenic techniques, and followed by we have discussed that is patient perspective, and then clinical perspective, why the cryogenic technique is very important. And then we discussed what is the working principle, that is science behind every cryogenic techniques, what is the threshold and biological effects, and what are the cellular mechanism is happening when you are performing cryogenic techniques. And then we also discussed what is a clinical application you can see with the use of this cryogenic techniques in modern medicine. That is, one is cryosurgery, another one is cryopreservation. And finally we have see the future direction of this cryogenic techniques. And thank you.